Hi. Today we have a fun topic to talk about, and that is what is a mommy makeover? Mommy makeover is a term that came from you guys, the patient population, the public at large. Just like gummy bear is a term that refers to silicone gel breast implants, and it has to do with the texture and feel of the implant and how it sort of reminded a patient years ago of gummy bears. Likewise, a boob job is a slang expression for a breast augmentation, but it's really quite frequently used. And more recently, Brazilian butt lifts have also become a part of our mainstream language. And as we know, a Brazilian butt lift usually means liposuction around the midsection, collecting the fat and injecting that fat into the buttock area. It is not intuitive that that would be a lifting of the butt, but it's certainly a reshaping and rejuvenating of the body in that region. So, what is a mommy makeover? Well, mommy makeover is another expression that's almost self-explanatory. The person has to have been a mommy, meaning that they've had children, they've childbearing, and they're being made over. Their body's being restored or returned back to their pre-pregnancy pristine appearance. You know, childbearing and having a family is a glorious, wonderful miracle, but it does take its toll on the body, particularly if the patient has had multiple pregnancies. You have a great obvious enlargement in the abdominal area. It produces stretch marks, and the stretch marked skin will frequently be stretched, and that skin will not shrink back because the stretch marks represent damaged elastic fibers in the skin that no longer allow that skin to shrink back to its pre-pregnancy size. Likewise, in the breast area, the breast enlargement that comes with pregnancy produces a stretching of the breast skin, and after pregnancy, as the breasts continue to involute or get smaller and lose that baby fat that was in the breast before pregnancy, the breast becomes saggy. So you have saggy breasts, frequently with stretch marks, abdominal skin, frequently with stretch marks. The hip area looks a little wider. And, you know, these patients that have had babies and are still young and active, and they still want to look sexy and be vibrant, and they just want to be given back some or all of what they used to have in terms of their pre-pregnancy appearance. So in my practice, a mommy makeover is a combination of an abdominoplasty and a breast lift, usually with an augmentation or a breast implant for enlargement. Now, a tummy tuck or an abdominoplasty entails removing of this excess skin and fat, along with repositioning the abdominal or the umbilicus, the belly button, and repositioning those rectus muscles closer together so that they have more of an hourglass figure, and their waist is brought in just a little bit by doing that muscle repair, as we call it. But that's the combination that just seems to be more frequent in my practice. A mommy makeover could include any combination of procedures that is designed to restore a female body after it's had children. That could include facial work, it could include liposuction in various areas, but I would say that in general it does tend to include abdominal and breast surgery most of the time. Now, in terms of timing of a mommy makeover, this is not something that should be undertaken within the first 3 months after having children, and more likely than not, it's probably wisest to do a mommy makeover after you're done having all of the children. I would not suggest that a mommy makeover be done and then you turn around and have a couple more babies. I think that you would probably reduce the effectiveness of the surgery that was performed, and so that probably would not be my number one suggestion. Although, on the other hand, I wouldn't be adamantly opposed to doing it, but I just think that it's probably best done after you have in fact finished those things. So I hope that this has been a helpful explanation. I think it's one of those take it easy kind of terms. And if a patient calls on the phone and says, I want a mommy makeover, I say, well, sure, come on in and we'll talk about it. And together we will go through a selection process of which components are the most out of line or the most in need of improvement. And that's how we would approach the topic. So be sure to give a complete health history to your doctor as you discuss the things that you want to have improved upon, trusting that they can do their best job if they're given the most information. Hope that this was informative, and we look forward to seeing you next time. Thank you.